Hello, doctor. My name is Callum Bailey. I'm a pharmacist here today. I just wanted to give you a recommendation on one of your patients that you're seeing. This is Mrs. Jane Doe. She's a 27-year-old African-American female. Her chief complaint is recent unprotected sexual encounter with husband after she ran out of oral contraceptive. Her other pertinent info is she has childhood asthma, no treatment or symptoms for 8 years, generalized motor seizures controlled on topiramate recently discontinued following unprotected sex with husband, looking for medication to restart or changes. Her past medical history includes childhood asthma, her motor seizures, which she's been stable for 2 months with topiramate medication. Her family history: her mother is alive, but she had a MI at age 58. Her father died of prostate cancer at the age of 62, and she has no siblings. Social history: she denies recent alcohol, former smoker, she quit 3 years ago, and she's a full-time student. Her medications and allergies: gabapentin, she had an adverse effect of edema. Her recently discontinued all meds. She was on topiramate due to patient preference against weight gain. She is up to date on all immunizations, and she had a recent influenza shot of January 2019. Her ROS is positive for lethargy, no acute distress. She is positive for breast tenderness, nausea, intermittent insomnia, and she is well nourished. Her blood pressure was 110/72, heart rate of 90, temperature of 36.8 degrees Celsius. Her respiratory rate was 14. She is 69 inches tall and 158 pounds. Her BMI is 23.3. Her urine HCG sample is positive. BMP is normal. CMP is normal. Her RBC was high at 5.1, and the normal range is 4.0 to 4.9. Her INR is normal. Her serum creatinine is 0.8, and her creatinine clearance is 110.8 or 111. The problem state is unplanned pregnancy and generalized motor seizures. The evidence of the problem is her positive HCG test. The goals for the problem is to refer her to an OBGYN, for her to be seizure-free, increase quality of life, and minimize adverse effects of the medication and medication adherence. So the first drug regimen that I'm going to recommend is to discontinue her oral contraceptive, which is the Tri-Sprintec. She takes that orally daily, and also her topiramate 100 milligrams oral twice daily. Discontinue that as well. I'm wanting to recommend the medication lamotrigine 25 milligrams orally daily for the treatment of her seizures, and also add folic acid supplements of 4 milligrams oral and daily. We want to monitor for rash and levels of the lamotrigine levels in her blood, and also we want to monitor the seizure frequency. The rationale for my plan is this is a first-line agent for pregnant patients with generalized epilepsy. Is monotherapy with lamotrigine due to side effects and the effects to the baby on the first-line medications is the reason for my recommendation. Thank you.